If your face looks like you're blushing and you get bumps that are a bit like acne, you might have a skin condition called rosacea. Rosacea is a common skin condition that causes redness and visible blood vessels in your face. It may also produce small, red, pus-filled bumps. There are 4 types of rosacea, though many people experience symptoms of more than one type. Papulopustular rosacea, erythematotelangiectatic rosacea, phoematis rosacea, and ocular rosacea. Erythematotelangiectatic rosacea is characterized by persistent redness on the face. Small blood vessels beneath the skin surface may become enlarged and visible. These symptoms often flare up and then disappear. Without treatment, the redness can get more persistent, cover more skin, and even become permanent. Papulopustular rosacea is associated with whitehead pustules, which are pus-filled blemishes, and red, swollen bumps. These typically appear on the cheeks, chin, and forehead and are frequently misidentified as acne. Facial redness and flushing may appear, as well. Severe papulopustular rosacea can cause upwards of 40 blemishes that can take a long time to go away. Blemishes may also appear on the scalp, neck, or chest. Phoematis rosacea causes skin to thicken and scar, making it bumpy, swollen, and sometimes discolored. This rare but treatable type most often affects the nose, resulting in what is sometimes called a bulbous nose or rhinophema, and appears more frequently in men than in women. Ocular rosacea. Symptoms affect the eyes, causing them to look watery or bloodshot. There may be an associated feeling of burning or irritation in your eyes. Ocular rosacea can cause persistently dry, sensitive eyes, and cysts may form on the eyelids. Ocular symptoms of rosacea may be more common than previously thought, because the connection between skin symptoms and the eyes can be easily overlooked. Rosacea is a progressive vascular disorder that affects the face and the eyes. Stage 1. Generally, people who are prone to frequent bouts of flushing and blushing are in Stage 1. The facial redness that occurs with the flushing or blushing is rather transient and disappears soon after the cause or trigger is over. Stage 2. This stage is the first true form of rosacea. It begins when the facial redness induced by flushing continues for an abnormal length of time after the trigger is over due to facial blood vessels remaining open. It usually continues for half an hour or more. The skin is often described as rosy or as having a healthy-looking glow. Stage 3. This stage begins when the facial redness persists for days or even weeks. In some instances, there is a semi-permanent redness in the central area covering the nose and cheeks. The face is often described as having a sunburned or windburned look. In most cases, there are prominent areas of telangiectasia, chronic dilation of groups of capillaries, in the areas where flushing is worse. Stage 4. Small portion of rosacea suffers progress to the severe form. At this stage, there are intense episodes of facial flushing, severe inflammation, swelling, facial pain, and debilitating burning sensations. The cause of rosacea is unknown, but it could be due to a combination of hereditary and environmental factors. Rosacea is not caused by poor hygiene. Rosacea can be caused or triggered by the following: sunlight, hot and cold weather, stress, drugs that dilate blood vessels, strenuous exercise, hot drinks, and spicy foods, and H. pylori bacteria. Your rosacea symptoms can come and go. They might flare up for a few weeks, fade, and then come back. The biggest thing you'll notice is redness on your cheeks, nose, chin, and forehead. Less often, the color can appear on your neck, head, ears, or chest. After a while, broken blood vessels might show through your skin, which can thicken and swell up. Up to half of people with rosacea also get eye problems like redness, swelling, and pain. Other symptoms you may get are stinging and burning of your skin, patches of rough, dry skin, a swollen, bulb-shaped nose and larger pores. Risk factors: anyone can develop rosacea, but you may be more likely to develop it if you are female, especially those who have light skin, particularly if it has been damaged by the sun, people who are between the age of 30 and 50, when you are a smoker, and a family history of rosacea. Treatment for rosacea focuses on controlling signs and symptoms. Most often this requires a combination of good skincare and prescription drugs. The duration of your treatment depends on the type and severity of your signs and symptoms. Recurrence is common. Topical drugs that reduce redness. For mild to moderate rosacea, your doctor may prescribe a cream or gel that you apply to the affected skin, such as brimonidine and azelaic acid. Dermabrasion, which sends off the top layer of skin. Laser therapy and other light-based therapies may help reduce the redness of enlarged blood vessels. Repeat treatments may be needed periodically to maintain the improved appearance of your skin. Thanks for watching. Don't forget to subscribe.